So capturing and using data. Now, the first thing I'd say to you is this has to, well, the first thing is, before you get into these conversations about, one step back, the golden rule of partnership working. There's two golden rules. The first one is, make sure your boundaries aren't the same, because then you can legitimately say, we'd love to work with you, but we can't because our boundaries are different. So that's the first rule. And the second one is, our data system's different to your data system, and we're not going to share it with you. So that's the second. Now, the second rule, my understanding is there's legislation going through your parliament now that will make it will put a law in place where data will be shared. Data will be shared. That's my understanding. I'm looking at Graham for a nod. Yeah? Okay? So don't get over-occupied on that conversation when you get into your table discussions. Well, you might want to think about, if that's coming, how are we going to do that? How are we going to do that? And how are we going to move that forward? The other thing I'd say about data is why do you want it? Why do you want it? If the reason you want it is because somebody's told you you've got to collect it, 9 times out of 10, it's not going to be helpful to you. It's not going to be helpful to you. I'd urge you to think about loving data because you want to have the data because it helps you understand whether or not you're making a difference. Now, some people might take that and start to talk about that's part of a performance management system. Well, actually, it's not about your performance, it's about your practice. It's about your professional practice. You need to know whether what you're doing is making a difference. And hard data is just one bit of the sort of feedback that you need. Everybody needs feedback, and the hard data is one bit. There's a lot of soft feedback that is equally important from other professionals, from children, from families, from partnerships, that tells you, comes together to give you a complete picture or a reasonable understanding of what's happening. But it starts with the hard data and getting your head around the hard data. There's probably two things at play. You won't get rid of the external demands on data. So you're going to have systems that do report into government initiatives or whatever, or maybe through your funding mechanisms you've got to send certain things back. But I'd obsess a little bit more on the internal use of data. We had give you a simple example. We had a situation where the strategy said we wanted to safely reduce the needs for children to be looked after by the state. We looked after numbers to come down. On that basis, we wanted kinship care numbers to go up. Okay? And we reached a point where that happened. The numbers started going down, and the number of kinship care placements went up. And we got the data, and we were very pleased with ourselves. Now, because we have a regular conversation where everybody has the opportunity to be in the room, so we have our leadership team, but it includes HR, it includes IT, it includes complaints, it includes the admin, it includes everybody who's got a role to play in how the organisation works. So when we were very pleased with ourselves and patting ourselves on the back that the looked after numbers have gone down, the kinship care numbers have gone down, hand goes up at the back, and Josie, the complaints officer, says, yeah, but we've got a load of complaints from kinship carers that we never had before. Why have we got a load of complaints from kinship carers? Finance guy says, I think we've got a problem in paying them. IT guy says, yes, we have. We haven't migrated the system that we use for foster care payments to kinship care payments yet. But we would never have known that if we hadn't had that conversation about the importance of data. So immediately we can sort that because people have got a collective responsibility about sorting it. So don't just take the first bit of evidence that comes to you. You're back to that contextual idea. And if you don't already have conversations that involve everybody who's got a role to play within your organisation, including all the support staff, get them into that conversation as well, because it's their data as much as it's your data. And the data is really a route into stories. It's stories about whether things work or not. Okay, so I've mentioned to you a number of times the importance I feel you have with, and the opportunity you have around results-based accountability. And this idea of turning curves and using data intelligently to change patterns, okay? And it's the brainchild of a guy called Mark Friedman, and I've known Mark for a number of years. We've been friends for a number of years. He's helped me in every job I've ever been in over the last 30 odd years. So Mark and I work together quite a lot. What you need to know about Mark, I'm going to show you a short clip of Mark, but I have to warn you, he has an amazing taste in Hawaiian shirts, okay? So, and I'll show you this one that he's wearing here. When I was working in Hull, he came to an event like this, and because we knew he would be wearing a loud shirt, we got everybody in the audience to wear a Hawaiian shirt of equal horror. Some of them were very nice, actually, and he didn't notice. He didn't notice. He went through the whole workshop and didn't notice. So, who's got the clicker? Me. So this is Mr. Friedman talking to you now.
The notion of proving impact, and so many funders these days ask providers, grantees, to prove that they've made an impact on the community, and it's the wrong question. In complex environments, one of the things we've learned from chaos and complexity theory is that cause and effect relationships are not just difficult to know, they're impossible to know. And so in a community level effort, an individual program will never be able to show or prove that it's created an impact at the community level. What programs can be asked to do is they can be asked to demonstrate that they've made a difference in the lives of their customers. And what programs do for their customers then becomes their contribution to community change. So the relationship between programs and community should no longer be thought of as a matter of proof of causality, but rather demonstrating contribution. Now, if we think about the complex set of actions that are typically embodied in a community change process, how do you know if a complex strategy is making a difference at the community level? And here we have not been given very good models to use by the research and evaluation community. Much of the research and evaluation community has been trying to apply the medical model, the control group research model, to complex community change processes, and it just doesn't work. You can't run a community change process for 3 years, see what happens, roll the community back, and run the community without the change process. It just doesn't make sense. So what we need are different models that help us explain whether a community change process is working or not. And I believe that there's actually a way to do this, which I write about in the book. And here's how it works. Imagine, if you will, that you have a curve that you're interested in turning. Whatever that happens to be, can be the juvenile crime rate, the teen pregnancy rate, the rates of air or water quality, it doesn't matter. If you have 3 pieces of evidence, you can begin to demonstrate your contribution to community change. And here are the 3 pieces of evidence. First, that we tried a bunch of stuff that had a credible chance of making a difference. And 2, we saw a timely relationship to 3, a turn in the curve. If you have these 3 pieces of evidence, you have what I think of as circumstantial evidence that what you did here contributed to, did not cause, but contributed to this turn in the curve. This is pretty much the best you are ever going to do in your career. But it's a powerful, powerful argument. And if you're able to tell this story, you'll have a convincing case with funders and with elected officials and with other stakeholders. If you think back to the stories that we looked at in the course of our morning workshop, Tillamook County, for example, has these 3 elements. They tried a bunch of stuff that had a credible chance of impacting the teen pregnancy rate in their county, and sure enough, we saw a timely relationship to a turn in that curve. In the case of the work of Mothers Against Drunk Driving, the same 3 conditions applied. They tried a bunch of stuff that had a chance of making a difference. It wasn't a token effort. And sure enough, they saw a timely relationship in the curve on alcohol-related traffic fatalities in the United States. And the same is true of Boston and all of these other stories. So what I believe is that we need the research and evaluation community and the funding community to give credence to this notion that this 3-part set of evidence is good enough for demonstrating contribution to community change for complex funded initiatives. And I believe that programs and communities will be better off for having their successes acknowledged in this way and not held to the unreasonable standards of medical model research which simply don't apply.
Okay, hopefully that makes sense. So hopefully if you picked up from what Mark was saying about stuff that's good enough. So don't obsess on trying to get the perfectly cleansed data. Get things that are going to get you moving in the right direction. So what we want you to do now on your tables, having done all your exercises, is have a conversation about that and put yourselves in the context that you are going to be given permission. There'll be an expectation that you share data, So if you're going to have that expectation on you now, how are you going to do that? What data are you going to share? What's the key data that you think you might want to share when you're looking at the life chances of children, safeguarding and promoting the welfare of children? And try and have that conversation. In the perfect world, you might get around to identifying a curve that you might want to turn, but given the nature and the number of people on each table, it's probably more about what's the data you're going to share, what's the data you're looking forward to sharing, and how will that embellish the stories that you need to understand about what it's like to be a child growing up in southern Australia, and how you're going to make things better. Okay? Right, just looking at the questions that were here, I picked a couple out. One of the first ones was, how long did it take you to settle on the indicators? How long did it take for people to be prepared to start doing the work? How long it took to get the system to collect data weekly in place? How important is this? Okay, so in terms of settling on the data or on the indicators, just have a look at the plan on a page again. Yeah. If you start on the left-hand side, which has got the 1 vision, 5 outcomes, 14 priorities, 3 obsessions, once you'd agreed what those were, and that was part of a collaborative process, and it's stuff, when you get beyond the 5 outcomes, and you looked at the priorities, then the question has to be, well, what's the indicator that's going to give us a reasonable stab at understanding roughly what's going on? It doesn't mean it tells you everything about what's going on. It just tells you it's what it is on the tin. It's an indicator. It's something that points you in the right direction to start asking probably some more questions about what's going on. So, and again, I suppose what I'd say to you is, don't over worry about this. Just get something that's going to point you in the right direction. Because it doesn't mean that on that page, that's the only stuff we collect in Leeds. We've still got warehouses full of data that we've probably never even looked at yet, but we've probably got, we still collect more than is healthy. But the indicators just give you a headline position to start to have the conversations about, is this going up, down or sideways? What's the story behind the baseline? Is the curve turning, etc., etc.? So it didn't actually take us that long to come up with that list and get a consensus that it's good enough to go, basically. Had we wanted it to be rocket science, we'd probably still here, well, I wouldn't be here because we'd still be trying to work it out back at the ranch. So just trying it, the starting point's the outcomes. Out of the outcomes, when you challenge yourselves about all children being safe from harm, what's the most troublesome part of that? What's the most troublesome part of that? That becomes your priority. How are you going to know if that's going to move one way or the other? That's when you get into your indicators. Go back, as I said before, to your RBA processes and the discipline that goes with that. So it didn't take long. That's how we got to them. It could have been a completely different list, but that was just where we ended up in terms of negotiations. So don't worry about it too much. The weekly data stuff, that's another story. So there's a phrase I use which sends fear into the team back in Leeds, which is at the press of a button. Excuse me. At the press of it, just making me laugh now, and some of the language that would be used if I said that in the team office. So we'd like this at the press of a button. Because in the perfect world, that's what you want. But it's not a perfect world, and you're not going to get your data as easy as that. The frequency, though, I think is quite important. And the reason we went for weekly, in my personal view of the world, actually, on looked after numbers, the children looked after by the state, we get that almost daily. But it's not a verified number, and it's not in any graphic form. It's just that we know now, or people know, that I want to know every day. It's important I know, it's important the leadership team know, it's important the politicians know, what's today's number, and it just again focuses your mind. But in terms of the presentation of material and trying to get it across the entire Children's Services Partnership, it's important to get something out that keeps people, or keeps reminding people, that this is the plan we're pursuing, this is why we're doing it, and these are the issues that we've agreed are important to us. So it took a little while, but once it people got into that, and we had to release some of it. Like I think we released the looked after children's data before we had a reasonable picture of school attendance. We were quite good on the NEAT data because that was linked around employment rates and various other things. So we already had access to some of that information. So it might not all, but we didn't wait until we had the thing of beauty all sorted and then start distributing it. We used to send all sorts of crude lists around or guesstimates at what the data was saying, and then it starts to mature in terms of the accuracy and the validity of that data as those conversations take place. You might have got some cluster that got their data and said, well, that's wrong. Well, that's wrong. Well, actually, you know how data works? Rubbish in, rubbish out. So if you don't fill the forms in, you don't send the stuff in, it doesn't get caught, therefore you can't have the conversation about it. So as soon as we started producing stuff that people said was rubbish, well, actually, do you know what? It's actually your rubbish, because that's the stuff you've given us. And people wanted it to be accurate because they couldn't go into those conversations without it being accurate. So that's where we got to with that one. We've got the stuff, how did you choose the data you now collect? How did you move from static data to collecting to real-time data? I think it's not real-time, okay? It isn't as real-time as I want it to be, but it's as near as we can get it to real-time, yeah? And that, again, don't go for perfection, go for good enough, something that gets you moving. Double handling of data, multiple frameworks of reporting, program outcomes, etc. The way the Children's Services Partnership works is, as Director of Children's Services, I don't manage everybody. I'm not the line manager of everybody across children, even though in statute the role of Director of Children's Services is accountable for everything to do with children's services in the City of Leeds. But I don't manage the police force, I don't manage health professionals, all the health professionals, I don't manage all the schools in that direct line management sense. I have a level of influence, I suppose, that comes with the statutory premise of the role. So you're never ever going to get rid of every single system that's doing something else or collecting data and doing something else. So it's another one of those things that you're just going to have to live with some of that. You have to live with some of the noise and the chaos that exists around different systems, but try and get a clear line of sight through the middle of all that, which goes from the plan, the outcomes, right down to what are we going to make real on the basis of that. And you might take some stuff from different systems on the way, but just navigate something that makes sense to people. You'll go mad if you try and make all the systems talk to each other and everything work like clockwork. There's people up and down around the world making a huge amount of money telling governments and telling organisations that they can sell you a product that will do that. Then they can't. And it's a bit of a holy grail that is just not worth pursuing. What you need to pursue is, if those are our outcomes, if those are our priorities, if those are our obsessions, what's the good enough set of data that's going to tell us whether, how much we've done, how well we've done it, and whether anybody's any better off. And then go with that. And it will mature over time. And it will mature because of the professional conversations between the top table and those local clusters and the conversations going back up again. And it will get better and crisper. How do you weight different types of data to provide the best picture? It depends on the importance that you've got within you've got your outcomes. It depends what importance you give those priorities. You might give a disproportionate weighting to children safe from harm depending on what the circumstances you're currently working in. So you might give a disproportionate weighting to kids who are looked after. You might give disproportionate weighting to activity at the front door in terms of referrals, if that's where your big problems are. Or it might be somewhere else. We had when I first arrived, I naively said, so we've got statutory responsibility for children when they leave the care of the state, known as care leavers. So when young people leave care, we're expected to keep in touch with them and know where they are, which is not unreasonable. It's what happens with our own children, so why wouldn't you want to do that? So when I asked, well, how many care leavers have we got in Leeds, we didn't know. Never mind where they were, or how well they were doing, or how well supported they were. So that became a priority for us. You know, you can't have that. You can't not know where children you're responsible for are. So we had to put a huge amount of work in to find out where they are. So the activity at that time was, where are they? So not how well are they doing and anything else, just where are they? Once you find out where they are, then you can start to challenge yourself about the qualitative things. How well are they doing? Are they in decent accommodation? Are they involved in education, employment or training? You know, what's their friendship networks, etc., etc. So that and then you might be looking at something else that becomes one of those troublesome data items. Okay, does that make sense? I think that was it, roughly. Is that okay? When we got involved with care leavers and started to talk to the young people themselves about, once we knew where they were, we started to talk to them on a regular basis and using their voice and their influence. And we put a whole set of proposals together that we were really pleased with about quality of accommodation, engagement with employment prospects, education, learning, etc., etc. And do you know what they came back when they looked at all that, and they came back to us and said what the number one thing was, which we would never have got to at all, just because we were looking at it through the wrong lens, really. The biggest thing for them was they were lonely. They were lonely. So they might be well connected in our eyes, good accommodation, job prospects, involved in education, etc. But it was that connections, those human relationships that they were missing out on. So that led us into trying to get involved in a different way. So don't take the data for what you think it is straight away, and respond to things in that way. I'm going to mention, sorry Chair, I'm winding back because I'm going to mention one other thing as well. When we started, we had probably the worst part, the scariest bit is that we had unallocated cases. So people had expressed a concern about the welfare of a child, and then we had unallocated cases. We accepted that concern about the welfare of a child, but it wasn't allocated to a social worker. Nobody was doing anything, so you had a pile. Now, that's scary. That's when you know you're not meeting your statutory responsibilities to safeguard and promote the welfare of children. And the data started to show that. So that became a priority. So that bit about weighting, that's a priority. So, and what that then showed us was not only if they're not allocated, then kids aren't seen. If kids aren't seen, then there isn't a plan. If there isn't a plan, it's not reviewed. So we took those 4 things and just said, it's a deal breaker. Everything's got to be allocated. Children have to be seen. They have to have a plan, and the plan has to be reviewed. Now, it's not perfect, but it's a good place to start and gives you some reassurance that you're connected with those children that you've accepted, have a legitimate, people are legitimately concerned about. Then, when you've got that, you can get into the qualitative side of it. Well, you know, did we allocate to the right person, the right social worker with the right skill mix? Did we match up the case to the professional expertise? What was, if the child was seen, well, what was that engagement like? How child focused was that engagement? How much was the engagement with the rest of the family? How did that work? The qualitative side of that. What sort of plan is it? How involved is the family and the child in that plan? How involved are they in the review process? But if you start from a premise where you've got gaps, big gaps in those key critical aspects of the data, which is fundamentally where are the children you're most worried about and who's doing what, who's knocking on the door, who's going to see them, then you've just got to wind back and get some of those basic things sorted out.